Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Breathe clean filtered air with an Airtamer Personal Air Purifier. It's easy to have filtered air with an Airtamer Personal Air Purifier. An Airtamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The Airtamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an Airtamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code Ageless Health and get a 10% discount. Order today.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Ageless Health live stream. This is Dr. Tom Roselle, and glad that you're here with me. We're going to talk about your low back today and the natural causes and consequences and things that you can do about it and so forth. It's the precursor to a program that we have coming up at the Roselle Center for Healing pretty quickly now. I think it's next month on the 14th. Of August at 6 p.m. at the Roselle Center in Fairfax, Virginia. So if you're anywhere in our neighborhood, I promise you this evening will be one that you really don't want to miss, because we're going to teach you how to, one, not get low back pain, two, make sure that you have the tools to fix it without somebody cutting into you, without somebody injecting you, without somebody telling you have to live with it for the rest of your life. That's unfortunate, but we have to make sure that you have options way before you get to that place. You know, we're in the middle of a summertime, if you will, wanting to have some fun, season, hiking and playing tennis and playing golf and playing outside sports and doing all those things, and just digging in our garden and maybe painting the house. And we don't do it. We have to put it off because our low back hurts. It's a problem. So if that's the case, is it something that we have to expect? I mean, we know that up to 70% plus 80%, if you will, of the world's population will have low back pain at some point. Now, that's a whole lot of people. And the other statistic is up to 40% of people have low back pain ongoing, intermittent, comes and goes. There's always that underlying residual. It's not something that, that they want to have, right? It's not a shining star on their chest, but it's something that, because of lifestyle, often, because we don't protect ourselves, because we don't do the things that we need to, that it shows up. So what's a person to do? Well, we're going to tell you about that today, and we're going to get into that just a little bit. And don't forget, mark in that situation. By the way, I want to kind of tweak something that we have coming up at the Roselle Center as well. Next weekend, we're going to have a Women's Day, and it's called a flower day, a flower essence day. And they're going to be, you're going to be able to see the natural remedies that are due because of flowers. They look like this, and they work on all kinds of things, from emotional problems to mental platforms and strength, physiological problems. I've seen some amazing things happen with these remedies, and I use them because, everybody in my office thinks that I'm just this crazy person that needs to be calmed down all the time. But seriously, you're going to enjoy it. We're going to talk about they're going to talk about the combinations of natural health care and just join them. They won't let me come. I can't be there. They told me, no, you can't come. And I said, okay, I won't be there. So unfortunately, but you have some great people: Dareth Painter, Sybil McFarland, Dr. Stephanie Pina, just to mention three of the people that are going to be there to answer your questions and talk you through this. So go online. You can go to rosellecare.com and check it out and see what that's all about. But I promise you're going to enjoy that day. I just wish I could be there with you, but I can't. So I'm being shunned. I'm being ostracized. It's a prejudicial thing, if you will. No, not really. You guys have a great time when you show up. Let's get back into low back pain a little bit and talk about what happens. So there's, when you talk about low back pain, you have to talk about all the things that cause it. So we can talk about low back from repetitive injury, meaning small little things that we're not prepared for. We're in the wrong position, if you will, like bending over all the time and picking things up the one-sided, doing this, sometimes not being supported in a chair, not sitting up the way that we're supposed to, sleeping on our stomachs, with our in an unsupported posture pattern. I know a lot of you say, I have to sleep on my stomach. Well, there's a better way of doing that. And you need to understand what that's all about. Or big traumas, a car accident, a fall. You said, well, I didn't hurt my back. Well, yeah, you did, because there's not one part of your spine that is independent of the other parts of your spine. It's all intertwined. It's all interrelated. So, for example, this big old bone called your skull, right? That works in harmony with your pelvis. Did you know back into the jaw here, there's two muscles, one on each side, called the pterygoid muscles. And the pterygoid muscles, when they're too tight and too locked down, you can't swing your leg to the outside. And it restricts abduction. When the temporal mandibular joint itself is jammed, it's locked up, your sacroiliac in your low back, you've heard the sacroiliac, your sacroiliac is also going to be compromised. So you have to look at the interplay of all these things. When the upper part of your neck is out of position, the last vertebrae in your low back will also be compromised and not work properly. Now we have to look at it as a foundational principle. We look at your feet. If your feet aren't working, if you're wearing high heels, then guess what happens? Your pelvis is going to be pushed forward and you're going to hyperextend back and you're going to jam that low back. And there are more and more mechanical pieces. Or you go out and you swing a golf club. And when you're swinging that golf club, you don't warm up before. You take the big old driver and you come down, and guess what? Your body's not prepared for it. It's cold. You're going to strain tissue and you're going to lock things up. Where if you took the time and you warmed up a little bit and then stretched before that, then your back might be loose enough that you're not going to get in any trouble. And then you begin to compromise. Remember, the golf game, you're on a pivot like this, right? It's like a top that's spinning if you're doing it the right way. But most of us don't do it the right way. So we have to make sure that we understand the mechanics and that there are certain precautionary, preventive, preemptive steps that you can take. How about if you're a tennis player or you're a racquetball player? Back in the day, I used to play handball. And did you warm up? Did you take your time? Did you go slow? Did you stretch? Or are you only using those muscles that you play the sport with and you're forgetting about everything else in your body? Instead of doing some Pilates and doing some core work, doing some stretching on a daily basis so you can do the things that you want to. You have those. How about the mechanical piece if you got way too much around the middle section? And there's no strength holding that. I'm telling you that that's not going to be very supportive long term, and it's going to predispose to many things, including bad knees and bad hips, but your low back is going to catch it first. You're going to have that kind of discomfort, that kind of pain. How about the chemical side of the triad? Chemistry, we're talking about anything that's exogenous, anything that's outside the body that affects the body inside. Things that we put into our mouth that we know we shouldn't eat, right? The sugars, the sodas, the coffee, the black teas, the fast foods, the fried foods, the alcohol, the gluten, the additives, the GMO modifications, and so forth. All of that nonsense that goes into our system. So does that cause a problem? I'm telling you it does, because this country, unfortunately, has the worst food ever. We were talking about the other day that I was, we were looking at a couple pictures of my high school back in, I won't even tell you how long ago that was, but it was a long time ago. And here's all these kids on the beach. Actually, it was in the 60s, right? So we're looking at all these kids, my generation, and we're out on the beaches and we're playing and we're running. And so there's nobody that was fat there. No one. Yeah, one or two. But that was the odd expression. Now we look at young kids and all of us, and we got a few more lbs on us than we should. Shouldn't be there. Why? Because we're slugs. We're sitting in front of computers and cell phones and so forth. You go around and everybody's got one of these, right? Everybody's got a cell phone. And their heads are down like this, and they don't get up, and no matter where they're going. The other day I was out in the Ashburn, Virginia area, and I saw a father and three kids. And what were they doing? They were walking together. It was a beautiful, beautiful day. All three of them, and they were all locked into their cell phones looking like this, and they were right together. They weren't talking to each other. And there was a slow walk, Thank God they were at least outside, but they weren't getting any kind of real exercise. Forget the interaction. And then the emotional piece, right? The emotional side of healing, the depression. And it's not, the depression and the anxiety pieces have to do with biochemistry inside. So that's the biochemical side of the triangle, the bioelectrical side of the triangle. But it's the decision processing that we go through, what we hold as true, and we believe, and we emotionalize, and we act upon enthusiastically, if you will. That's what our reality is. That's what we're going to produce. So all these guys interact when it comes to low back pain and structural pain. So then we look at how does it affect the body? Well, it can affect the blood supply. It can affect the body and predisposing it to getting infections. So we know we have things called osteomyelitis, and that just means you got an infection of the bone. And you think something's painful, wait till you have that experience. That's not okay. Those disc spaces, break down and life goes down the tubes real quickly. But the setup, if you will, of all these interactive pieces, the emotional low back pain, if you will, the I can't do attitude, the unwillingness to get off your butt and get outside and just go for a walk. I tell patients, look, nothing else, get up in the morning and walk out 5 minutes and walk back 5 minutes. 5 minutes, that's it, just 5 minutes. And breathe while you're out there. 5 minutes out, 5 minutes back. Then what do? You add a little bit to it. You add maybe a minute going out and a minute coming back. And you do that next week. Now you add another minute and another minute. Now you've got 7 minutes and 7 minutes. You got almost 15 minutes that you're out for a walk. And if you do that slowly, incrementally, and then pretty soon when you got 20 minutes to a half hour, I'm not telling you how fast to walk. I'm just telling you to walk for a period of time. Then when that becomes pretty easy and you're breathing, then go buy these 1 pound weights that you put on your hands and on your ankles and go for a walk and just walk and just walk. And that now becomes a mechanical strengthening exercise for your spine and so forth. Osteoporosis can't live in you if you're eating well and you're exercising. And that, my friends, is the only exercise that you would really need if you're eating properly to balance things out, setting aside hormonal disrelationships and so forth. But we're talking about low back pain and the slow incremental process of getting off your butt and doing something that might be supportive of your body having function at a much higher level. And I'm going to tell you a few more things as we go through so you can deal with it. But I want you to understand that you don't have to wait to the point where somebody's going to say, we have to do these deep Depo-Medrol injections. They're going to inject into the disc with a steroid in the hopes that they can shrink it down and drop the inflammatory levels down low, right? Well, I don't know about you, but don't you think we could do something before we get there? I think that might be appropriate. So we have to understand, not to wait. So if that doesn't work, guess what the next step is? Well, then you're going to make some surgeon, you're going to make his house payment because they're going to cut you down. They're going to either remove the gliding points in your spinal area called the facets. And if they do that, now you have a permanent instability of your low back. And if you ever get out of shape, which you should have stayed in shape before you even got to that place, you're going to have all kinds of problems again. By the way, just as a statistical pattern, do you know that only 50% of all low back surgeries are effective? And when they mean effective, what they're talking about is that the problem gets a little better or a lot better, or at least it doesn't change. And that the majority of low back surgeries fail within 10 years. And it's like you never had anything done. So why go through all of that when maybe you can prevent it from ever getting to that place? Understand that you are an intertwining, interrelated mechanical and biochemical piece of machinery. And if you do the right things and you support it, here's the other piece. We need collagen, which is a protein, And the end piece of that is a peptide, a collagen peptide, to repair cartilage in your joint spaces. And we're talking about your low back. So if we're not getting enough protein in our own diet, eating properly, eating adequately, setting the junk food aside, the sugars, the sodas, that junk food, then we're not getting enough peptide to repair the cartilage. And we become more predisposed to the problems that cause our low back pain to be there and persistent and never go away. Now, this is a worldwide problem. Now, saying worldwide, most countries outside of the United States don't have the percentages that we have in good old USA. We got a problem, folks, and we have to make sure that we understand that there's a preventive process that we can do something about to resolve, to change, to fix before we get to that place where we're going to be impaired, infirmed, and not able to live our life the way we choose to live it. So listen up. If you're suffering from low back pain, there's a lot that you can do. And by the way, on the 14th of August, 6 p.m., join me. Dr. Harlan Browning, the professor, if you will, is going to be my co-presenter. And Dr. Browning is probably one of the most amazingly competent and capable people that I've ever met. He's got his credentials are like crazy. He's got a diplomate specialty, if you will, in my area called applied kinesiology, one in nutrition. He's got one in neurology. And he and I and our practice deal with these things ongoing. We're going to talk about spinal decompression. You see them out there, you see all the ads for it. And we use something called a Cox decompression unit. There's the one out there called the DXR 9000. There's other methods as well. There's a lot of ways of going after this animal, but you have to treat it multidimensionally. You got to look at the chemistry. You got to put out the fire. Did you know that if your intestinal tract is not working the way it's supposed to, if your gut doesn't work, then you're going to have inflammatory reactions that go right to the disc, and that disc begins to swell. It gets big, and then all you got to do is sneeze or cough or bear down too hard, and guess what happens? You have a slip disc. You're going to have something that just pops. I don't know if you guys remember a quarterback by the name of Joe Montana, played for the 49ers. And when he was in the middle of his career, he dropped back for a pass and he threw from the right to the left and he twisted his spine really hard. He sheared his low back disc. It blew right there, bang, right now. And so were there some problems with that? I have a friend of mine that used to treat him out in that area. And he said, the guy was in really good shape, but back in the day with like a lot of the athletes of his generation, they exercised, but not like our elite athletes do today. So he didn't have as much rotational core for that type of throw. And he has so much power that he let that ball fly and it twisted the spine and boom, there went the disc. Now, he was in good shape comparatively to the rest of us. So what chance do we have if we don't prepare our body for life? We are athletes in our own homes. We are athletes in our own industries. And we have to have a capacity to stay strong. How do some people seemingly go on forever and can do things that, oh my God, how did you do that? Because they took the time to put the right pieces of the puzzle in place. I was talking to a young guy the other day and he says, hey, doc, he said, how long are you going to practice? I said, well, my target right now is another 30 years. He looked at me like I was, what, 30 years? Why? And he said, but you've already been in the practice. And I said, yeah, so is there a reason I should stop? And he couldn't understand that I have begun to prepare myself for that. If the good Lord wants me there, I'll make it. But also, I have to take my body and make it my responsibility to begin to prepare myself to do all the things that I want to do moving forward. And that means eating the right way. That means getting a modicum of exercise on a day-to-day basis. That means making sure that my focus, my intention, for me, it's prayerful, because that's who I am and that's what I do, lines up with that vision of another 30 years. But you know what? It's just not about seeing patients. It's also about going out and doing things that I love to do. It's also maybe, jumping out of a perfectly good airplane at 14,000 feet. I did the first time when I turned 50. That was a great time, by the way. I jumped out of a perfectly good airplane at 14,000 feet. I took my first flight lesson, and I hit the gym, and I had lunch with some of my best friends, and it was a great day. So I'm planning that again coming up pretty soon. I'm going to celebrate that, and we're going to do those things again. But I'm going to make sure that I have the capacity physically to be able to do those things. How about you? How many things that you want to do? I still love to scuba dive. I love going underwater and seeing what's there. But I have to have strong legs and strong back and strong abdomen and strong core to be able to flip those flippers, right? I've got to be able to move them. How about you? What do you want to do? Do you want to get rid of the pain? I'm telling you that you can get rid of the discomfort. There's no reason that you have to live with it. Check out what you're doing nutritionally. Check out what you're doing biochemically. Are you eating the way you're supposed to eat? Or are you kind of throwing things down your throat just because, grabbing a candy bar and a soda and you're off? Well, that candy bar is going to first give you, oh, hey, I'm awake again, and then it's going to crash you on the other side. That soda is going to, because of the phosphoric acid, is going to deplete the calcium out of your bones, and it's going to drop you down the other side because of the caffeine in it. Why is it that we've been sucked into doing it the wrong way instead of completing the process as we should be completing it? Meaning start, move, finish when it comes to our bodies. We have this amazing system called our bodies, and then we want to what? We want to strengthen it. We want to support it. We want to fuel it. We want to move it along accordingly. And then if we have to finish it when it's all done, we shouldn't have to do it as an invalid. We shouldn't have to do it as a cripple. We should just say, okay, it's done, and time out, and we're gone. But unfortunately, if you want to see what happens, go to rehab center sometime. Go around and watch these people sitting in wheelchairs. Go to a rehab center and watch their inability to do much of anything else, having to get up, with assistance, and then not walking unless they have a walker. That's preventable. You don't have to go there. And we're going to tell you a whole lot about that on the 14th. So please join Dr. Harlan Browning at Roselle Center for Healing in Fairfax. I promise you, I'm going to give you keys. I'm going to show you how to do it. You got to register for the class. Don't forget to do that. Matter of fact, do it today, right after the program. Go on to rosellcare.com or drtomroselle.com. Register for the class, and just remember that you have to, let us know if you're not going to make it, and that way we can make room for somebody else. Okay. And don't forget, next week, you're going to have the opportunity to come in and do the Flower Day with Dareth Painter, Sybil McFarland, Dr. Stephanie Pina. It's a woman's day. It's only for women. It's not for the guys. Guys, you can't come. I can't come. Stay home. Don't even get frustrated. Don't show up, because these women, they get a little crazy. They'll bounce you. So show up and have a good time. I wish I could be there with everybody that comes, but it's a women's day only. Enjoy the day. It'll be a great, great opportunity to learn a lot of things in the natural healthcare that's specifically for women. And I think you're going to be impressed. Having said that, we'll continue the process of educating you. Remember, I do this program, Ageless Health, simply because of what it stands for, Ageless Health. And by the way, I think we still have, copies of my original book, Ageless Health. Health is a do-it-yourself program available. And just go online to drtomroselle.com. It should be there, and we'll make it happen. Having said that, got a lot of stuff planned for you. And I think this year is going to be very exciting. We're actually talking about redoing our old Ageless Health seminars. And those of you who have been there remembered them, that they were amazing. It's like commentary was like drinking out of a fire hose. We gave you so much that you could go home with. But I'm going to tease you with that right now, and that just keep an eye out for it, and you never know what's going to happen with me. Having said that, you can have a great, great day. And remember, I do this program for one reason only. I love you all. See you later. Bye.